Welcome to the deep dive, where we take a stack of sources, extract the most important insights, and help you get well informed fast.
Mhm.
Today, we're embarking on a deep dive into a topic that touches countless lives, yet is, well, profoundly misunderstood: depression.
Yeah.
We'll be drawing primarily from an authoritative guide by the National Institute of Mental Health, aiming to give you a clear, comprehensive understanding.
Our mission today really is to cut through the common misconceptions
Right.
and clarify what depression truly is, how it manifests across different individuals, and most importantly, how it can be effectively addressed, with real pathways to recovery.
And what immediately stands out right from the source material is this. While we all experience fleeting moments of sadness,
Sure, everyone feels blue sometimes.
clinical depression is something far more significant. It's identified as a common but serious illness.
Mm.
And the source makes it unequivocally clear that most who experience it actually need treatment to get better.
That's a crucial starting point.
So let's unpack these distinctions and really help you understand the nuances.
Okay.
So let's start with the fundamental question. What exactly is clinical depression?
Well, the source makes it clear it's much more than just, a fleeting moment of sadness that passes in a couple of days.
Right.
When someone has a depressive disorder, it profoundly interferes with their daily life,
Mm.
their normal functioning.
Causes real pain.
Yeah, real pain, not just for them, but for their loved ones too.
And this is a critical distinction, isn't it? Because it's common but serious.
Exactly. A serious illness, yet one with significant hope. The vast majority of people, even those with the most severe forms, can and do get better with treatment.
That understanding is foundational, really.
Absolutely. To everything else we'll discuss.
And it's not just one single condition, is it? I mean, the guide outlines several key forms.
Indeed. The most common is probably major depressive disorder, often just called major depression.
Okay.
And this is characterized by symptoms severe enough to truly disable a person, interfering with their ability to work, sleep, eat, find enjoyment in things they once loved.
And it can come back.
Yes, while an episode might occur just once, it very often recurs throughout a person's life.
Then there's dystemic disorder, or dysthymia. What's that about?
So this form is long-term, lasting 2 years or longer.
2 years.
Yeah, with symptoms that are generally less severe than major depression. But even so, it can still prevent someone from functioning normally or feeling well for extended periods.
And it can get worse sometimes.
Yes, complicating matters. People with dysthymia can also experience major depressive episodes on top of it, sometimes called double depression.
Okay, so those are the broader ones. But there are more specific types, too.
Right. The source also delves into more specific forms, equally important to recognize. For instance, psychotic depression.
Psychotic.
Yeah, it occurs when severe depression is accompanied by psychosis, meaning a break with reality. Things like hallucinations or delusions.
That sounds incredibly difficult.
It is. And then there's postpartum depression.
Right, after having a baby.
Diagnosed when a new mother develops a major depressive episode within 1 month after delivery. It's estimated to affect maybe 10 to 15% of new mothers.
That's a significant number.
It really is. Highlights it needs serious attention.
And finally, SAD, seasonal affective disorder.
Correct. This is characterized by the onset of depression during winter months, typically when there's less natural sunlight.
Makes sense.
The good news is it generally lifts in the spring and summer. Light therapy can be quite effective for SAD.
But not always enough.
Right. The source points out that often people also need antidepressant medication or psychotherapy or both. Nearly half don't respond fully to light therapy alone.
Okay, so we've got these different forms. Now, how does it actually show up? Because the symptoms aren't the same for everyone, are they?
That's a vital point. No, it's rarely a one-size-fits-all picture. What it looks like for one person can be profoundly different for another.
The severity, how often symptoms appear, how long they last.
Exactly. It truly varies depending on the individual and their specific illness. It's not a simple checklist where everyone ticks every box.
More like a constellation of possibilities.
Let's put, yeah.
Right. But while it's not a simple checklist, there are common threads, right? Things we often see.
Yes, definitely. These can include persistent, sad, anxious, or sort of empty feelings.
Hopelessness, pessimism.
Feelings of hopelessness, pessimism, guilt, worklessness, or helplessness. Or sometimes heightened irritability and restlessness.
And loss of interest. That seems key.
A huge one.
Yeah.
A significant loss of interest in activities or hobbies once pleasurable. And the source notes this often extends to areas like intimacy, sex drive.
Okay. And feeling tired.
Profound fatigue, yes. Decreased energy. Difficulty concentrating, remembering details, making decisions. That cognitive fog.
Sleep gets disrupted too, I imagine.
Almost always. It can manifest as insomnia, waking up really early, or even, for some people, sleeping way too much. Excessive sleeping.
And eating habits.
Those can swing dramatically, too. Either significant overeating or complete appetite loss.
And then the really serious end? Thoughts of suicide?
Tragically, yes. Thoughts of suicide or actual suicide attempts are a very serious symptom, must always be taken seriously.
What about physical stuff? I've heard depression can cause physical pain.
Absolutely. What's often overlooked are the physical manifestations. The source highlights persistent aches or pains, headaches, cramps, digestive problems.
You don't respond to normal treatment.
Exactly. They just don't ease, even with traditional medical treatment. Which kind of brings us to a critical point,
Which is?
that depression often doesn't travel alone.
Ah, right. Coexisting illnesses.
Yes. The National Institute of Mental Health really emphasizes that these co-occurring illnesses need to be diagnosed and treated concurrently.
Because they can interact.
Yeah, they can precede the depression, cause it, or even be a consequence of the depression itself. It's complex.
And anxiety seems like a big one here.
Huge area of co-occurrence. Conditions like PTSD, post-traumatic stress disorder,
OCD, panic attacks.
obsessive-compulsive disorder, panic disorder, social phobia, generalized anxiety disorder, they frequently accompany depression.
Is there data on that? Like how often?
Actually, yes. What's truly insightful here is an NIH-funded study. It found that more than 40% of people with PTSD also had depression at 1-month and 4-month intervals after a traumatic event.
Wow, 40%.
It suggests a powerful, almost interwoven relationship. Meaning if someone's dealing with trauma, we must be looking for depression too, and vice versa, for comprehensive care.
Makes sense. What about substance abuse?
Another common co-occurrence. The source notes the pervasive coexistence of mood disorders and substance abuse. It's a significant factor across the U.S. population.
And serious medical conditions.
Yes, depression frequently coexists with things like heart disease, stroke, cancer, HIV/AIDS, diabetes, Parkinson's disease.
And does the depression make the other illness worse, or vice versa?
Here's a particularly critical finding from the research. People with coexisting depression tend to have more severe symptoms of both illnesses.
Oh, wow.
They experience more difficulty adapting to their medical condition and, unfortunately, incur higher medical costs.
But there's good news too.
Yes, and this is truly powerful. Research consistently shows treating the depression can actually help improve the outcome of treating the co-occurring medical illness.
That really shows how linked mental and physical health are.
It's a testament to that connection, absolutely.
So we've explored what depression looks like, how it presents, how it often travels with other conditions. But the big question for many is, why? Why does this happen?
Right, and what the source makes clear from the outset is that there's no single, simple answer, no single known cause.
It's complex.
Exactly. It's understood to be a complex interplay, likely a combination of genetic, biochemical, environmental, and psychological factors all contributing.
And the research really points to the brain itself, right, as being involved.
Yes, depressive illnesses are considered disorders of the brain. Technologies like MRI, brain imaging,
They show differences.
they've actually shown that the brains of people with depression can look different from those without it. Specifically, areas responsible for regulating mood, thinking, sleep, appetite, behavior. They appear to function abnormally sometimes.
And the chemistry, neurotransmitters.
On a chemical level, there's evidence that key neurotransmitters, the chemicals brain cells use to communicate.
Like serotonin.
Exactly. Serotonin, norepinephrine, dopamine, they appear to be out of balance in depression.
But the imaging doesn't tell the whole story yet.
No. While these techniques offer valuable insights into brain activity, they don't yet fully reveal the complete why behind the onset. Not just yet.
Okay. And beyond the brain's internal workings, what about genetics? Does it run in families?
It can, yes. Some types of depression do tend to run in families, which strongly suggests a genetic link.
But not always.
Crucially, no. It can certainly occur without any family history. The overall risk seems to result from multiple genes interacting with environmental or other factors.
Like stress or trauma.
Exactly. External stressors can definitely play a significant role. Things like trauma, the loss of a loved one, a really difficult relationship, Any highly stressful situation can trigger an episode.
And once you've had one episode,
What's also quite notable is that subsequent depressive episodes may occur even without an obvious external trigger, once that initial vulnerability has sort of been established.
right, okay. Now, what I found particularly insightful from the source is how differently depression can show up depending on who you are.
Yes, the demographics. It's not the same for everyone, and understanding these nuances is vital.
Let's start with women. It's more common in women, right?
It is, yeah. Depression is more commonly diagnosed among women than men, and this seems to be due to a complex interplay of factors.
Like biological, hormonal.
Biological, life cycle, hormonal factors like postpartum changes, PMDD, the menopause transition.
And social factors, too.
Absolutely. Alongside psychosocial factors like the significant stresses of work-home responsibilities, caring for children and aging parents, experiences of abuse, poverty, relationship strains, it all adds up.
And it's really important to emphasize here, again, postpartum depression is serious.
So important. It's a serious medical condition requiring active, specific treatment. It's distinctly different and far more severe than the baby blues, which are more transient.
Okay. Now, what about men? The source says they often experience it differently.
They do. Men often experience and cope with depressive symptoms quite differently than women.
How so?
While men are typically more likely to acknowledge symptoms like fatigue, irritability, a general loss of interest, sleep disturbances,
Whereas women,
women more often express feelings of sadness, worthlessness, or excessive guilt. That's a tendency, of course, not universal.
that's a crucial distinction, and coping mechanisms might differ too.
Yes, the source indicates men are often more likely to turn to alcohol or drugs to cope when depressed.
Or anger.
Or they might become frustrated, persistently discouraged, angry, even abusive sometimes. Some men immerse themselves in work or engage in reckless, risky behavior.
As a way to avoid dealing with it.
Seems like it. A way to avoid acknowledging or discussing their depression.
And there's a really sobering statistic related to this, isn't there, about suicide?
Yes. It really drives home the severity of this difference. While more women attempt suicide, many more men tragically die by suicide in the United States.
That points to a critical need for different approaches, different ways to reach men.
Absolutely. Detection and support need to be tailored.
Okay, let's shift to older adults. The guide makes a really important point here.
Crucial point. Depression is not a normal part of aging.
Right. Most seniors are actually satisfied.
The majority are quite satisfied with their lives. However, when older adults do experience depression, it can be easily overlooked.
Why is that?
Symptoms might be less obvious or less readily acknowledged by seniors themselves. Plus, it's often compounded by co-occurring medical conditions.
Like heart disease, stroke.
Exactly. Or cancer, or even side effects from necessary medications. All these can contribute to depressive symptoms, muddying the waters.
And there's something called vascular depression.
Yes, some older adults may experience vascular depression. This results from hardening blood vessels impacting blood flow to the brain. It often coexists with cardiovascular illness or increased stroke risks.
And suicide risk is high in some older groups.
Stark reality from the data. Older white males, aged 85 and older, have the highest suicide rate in the U.S.
Wow.
And this is often linked to undiagnosed depression, even though these individuals frequently visit their doctors shortly before their deaths.
Underscores the need for vigilant screening.
Absolutely vital.
Finally, let's touch on children and adolescents. Depression can start young.
It can. Research clearly shows childhood depression often persists, recurs, and can continue into adulthood, especially if untreated.
And it predicts worse outcomes later.
It can predict more severe adult illnesses down the line, yeah.
But diagnosing kids is tricky. Symptoms look different.
Very challenging. Symptoms vary a lot by age. Younger kids might pretend to be sick, refuse school, become unusually clingy.
And older kids, teenagers.
Older children and adolescents might sulk, get into trouble at school, exhibit negativity, show persistent irritability, or feel profoundly misunderstood.
Is there a gender difference early on?
Interestingly, before puberty, boys and girls are about equally likely to develop depression. But by age 15, that shifts dramatically.
How so?
Girls become twice as likely as boys to have experienced a major depressive episode by then.
And it often comes with other problems in teens.
Yes, depression in adolescence frequently co-occurs with other significant challenges: anxiety, disruptive behavior, eating disorders, substance abuse.
Which increases risk.
Significantly increases the risk of suicide. emphasizes the need for comprehensive, careful attention for this age group.
Okay, so we've covered a lot about what depression is, how it looks, who it affects. What does all this mean for getting better?
Well, the truly good news, according to our source, the NIMH guide, is that depression is highly treatable, even severe cases.
And starting early helps.
Critically, yes. The earlier treatment begins, the more effective it tends to be.
So what's the very first step?
The first and most important step is to visit your doctor. That initial consultation is crucial
Why start there?
because certain medications or underlying medical conditions like a virus or a thyroid disorder can actually cause symptoms that mimic depression.
Ah, so you rule those out first.
Exactly. Your doctor can do that through a physical exam, a thorough interview, maybe some lab tests.
And if it's not a physical condition,
Then the doctor should either conduct a comprehensive psychological evaluation themselves or, more likely, refer you to a mental health professional.
what does that evaluation involve?
Typically includes gathering a family history of depression, getting a full history of your symptoms when they started, how bad they are, if they've happened before.
Discussing substance use, suicidal thoughts.
Yes, openly discussing alcohol or drug use and any thoughts of death or suicide. It's all part of getting an accurate picture.
And once there's a diagnosis,
The good news is there are several highly effective treatment methods available. The two most common are medication and psychotherapy.
okay, let's talk medication first. Antidepressants. How do they work, basically?
They work by helping to normalize those natural occurring brain chemicals, the neurotransmitters we talked about.
Serotonin, norepinephrine, dopamine.
Exactly.
Yeah.
Which are often out of balance in people with depression.
And there are different types. SSRIs, SNRIs.
Yes, our source highlights that the newest and most frequently prescribed types are selective serotonin reuptake inhibitors, SSRIs, you might know names like Prozac, Celexa, Zoloft,
Mm-hmm.
and serotonin and norepinephrine reuptake inhibitors, or SNRIs, like Effexor, Cymbalta,
Why are they so popular?
largely because they tend to have fewer side effects than the older classes.
Like tricyclics and MAOIs?
Right, tricyclics and monoamine oxidase inhibitors, or MAOIs. Though it's worth noting, for some individuals, those older meds might still be the most effective choice.
Okay. And MAOIs have specific warnings, right?
Very vital to understand, yes. Especially concerning MAOIs. People taking them must adhere to significant food and medicinal restrictions
Why is that?
to avoid potentially serious, even dangerous interactions. For example, they need to strictly avoid certain foods high in tyramine,
Found in.
cheeses, wines, pickles, things like that, and some common medications like decongestants.
What happens if they mix?
It can cause a sharp, dangerous increase in blood pressure, potentially leading to a stroke. Your doctor will provide a complete, detailed list of what to avoid.
Really underscores the need for close communication with your doctor.
Absolutely critical.
And how long do these meds take to work? Is it instant?
No, not usually.
Okay.
For all classes of antidepressants, it typically takes at least 3 to 4 weeks of regular doses to experience the full therapeutic effect.
So patience is needed.
Definitely. And even if you start feeling better, it's crucial to continue taking the medication exactly as prescribed.
To prevent relapse.
Exactly. To prevent a relapse. And always, only stop under a doctor's supervision. Some meds need to be gradually tapered off.
What about side effects? Are they common? Severe?
Side effects can occur, but they're often mild and temporary, especially with the newer medications.
Like what?
The most common ones for SSRIs and SNRIs include headache, maybe nausea, insomnia, nervousness, agitation.
And sexual side effects, I hear about those.
Yes, that's a common concern for both men and women. Things like reduced sex drive or difficulty with orgasm.
And the older ones, tricyclics, different side effects.
They have their own specific potential side effects, yeah, like dry mouth, constipation, bladder problems, maybe blurred vision, daytime drowsiness.
The key thing is,
Report any unusual or interfering side effects to your doctor immediately. Never just try to manage them on your own.
okay, now there's something called a black box warning, especially for younger people.
Yes, a significant point. The FDA issued this warning label back in 2005 on all antidepressant medications,
And it was extended.
later extended to include ages up to 24 in 2007.
What does the warning say?
It specifically alerts the public about a potential increased risk of suicidal thinking or attempts in children, adolescents, and young adults.
How much of an increase?
The data showed about 4% in those taking antidepressants versus 2% on a placebo, especially during the initial weeks of treatment.
So monitoring is key.
Absolutely vital. Patients in this age group need to be closely monitored for any worsening depression, signs of suicidal behavior, or unusual changes in behavior overall.
But the benefits usually outweigh the risks.
That's important to note too, yes. Comprehensive reviews suggest the benefits of these medications generally do outweigh these risks for major depression and anxiety disorders in youth when they're managed properly by a healthcare professional.
Got it. Now, shifting gears slightly, St. John's wort, we hear about that a lot. Natural remedy.
It comes up often, yeah.
What does the NIMH guide say about its effectiveness, especially for major depression?
That's an excellent question given its popularity. So an NIH-funded clinical trial rigorously investigated St. John's wort and found it was no more effective than a placebo in treating major depression,
Really? No better than placebo.
according to that major study, yes, which challenges a common perception.
And are there safety concerns? Interactions?
Even more crucially, yes. The source warns it interacts unfavorably with many prescribed medications,
Like what?
including those for HIV, heart disease, seizures, certain cancers, organ transplants, even oral contraceptives.
Wow. Okay. So the message is,
Always, always consult with your doctor before taking any herbal supplement. Natural does not automatically mean safe, especially when combined with other medications.
good advice. Okay, so besides medication, there's psychotherapy, talk therapy.
Yes, highly effective treatment, often on its own or in combination.
Are there specific types that work well?
Two main types are noted as particularly effective: cognitive behavioral therapy, or CBT.
What does that do?
CBT helps people identify and change negative thinking patterns and behaviors to contribute to depression.
Okay. And the other one?
Interpersonal therapy, or IPT. That focuses more on understanding and working through troubled personal relationships that might be impacting mood.
When is therapy the best choice? Or is it always combined with meds?
Psychotherapy can be the best primary treatment option for mild to moderate depression.
But for more severe cases, or certain groups,
Here's a significant finding. For major depression, and specifically for adolescents and older adults, studies consistently indicate that a combination of medication and psychotherapy is often the most effective approach.
for getting better initially and staying better.
Exactly, for both initial treatment and powerfully for preventing recurrence.
Okay. And then there's ECT, electroconvulsive therapy. That sounds intense.
It does, and it's reserved for severe treatment-resistant depression where other methods haven't yielded sufficient results. But it can be highly effective in those cases.
Has it changed over the years? I think people hear shock therapy and get nervous.
Greatly improved. It's quite different from its past image. Today, it's administered under brief anesthesia with a muscle relaxant.
So the patient isn't aware, doesn't feel it.
Correct. The patient does not consciously feel the electrical impulse. And it can provide profound and rapid relief for severe depression.
Are there side effects? Memory loss?
It may cause short-term side effects like confusion, maybe disorientation, some temporary memory loss right after the treatment, but these typically clear up soon after.
What about long-term?
Importantly, recent research indicates no adverse long-term cognitive effects after 1 year of treatment.
Good to know. Okay, let's move to support. For someone listening who wants to help a friend or relative who's depressed, what's the first step?
The first and most important thing you can do is actively help them get an appropriate diagnosis and treatment.
Like practically?
Yeah, practical steps. Making an appointment for them maybe, or even going with them to see the doctor. Offering that practical support.
And emotional support too.
Absolutely. Offer unwavering emotional support, understanding, patience, consistent encouragement.
Just listening helps.
Engage them in open conversation. And perhaps most importantly, listen carefully without judgment.
What shouldn't you say?
Never disparage their feelings. Don't tell them to just snap out of it. Instead, gently point out realities and consistently offer hope. Remind them it's a treatable illness.
And if they mention suicide,
This is absolutely crucial. Never, ever ignore comments about suicide. You must report them to their therapist or doctor immediately or seek emergency help. Don't handle that alone.
should you try to get them out? Do things.
Continue to invite them for walks, outings, activities you know they once enjoyed. Keep gently trying even if they decline at first.
I don't push too hard.
Exactly. Find the balance. Don't push them to take on too much too soon. Overwhelming demands can unfortunately increase feelings of failure.
And keep reminding them.
That with time and consistent treatment, the depression will lift. That message of hope is key.
Okay, now flipping it. If you are the one experiencing depression, how can you help yourself through it?
First, it's vital to try and understand that those feelings, exhaustion, helplessness, hopelessness, are often symptoms of the depression itself.
They aren't reality.
They don't accurately reflect your actual circumstances. And that negative thinking will begin to fade with effective treatment. Try to hold on to that.
What about activity, exercise?
Even small steps can make a difference. Try to engage in mild activity or exercise regularly. Gently revisit activities you once enjoyed, movies, music, ball games, even just for short periods.
Setting goals.
Set realistic goals. Break down larger tasks into smaller, more manageable ones. That helps avoid feeling overwhelmed.
Isolate or connect.
Connect. Spend time with other people, even when you don't feel like it. Confide in a trusted friend or relative. Try actively not to isolate yourself. Let others help.
And be patient with yourself.
Yes. Set realistic expectations for improvement. Expect your mood to improve gradually, not overnight. Often, sleep and appetite start to get better before your mood completely lifts. That's progress.
Big life decisions. Wait on those.
Definitely best to postpone important life decisions. Marriage, divorce, big job changes. Wait until you feel better, clearer-headed.
Talk them through.
When the time is right, discuss these decisions with others who know you well and can offer a more objective perspective.
And remember, the negative thinking isn't permanent.
Always remember that positive, balanced thinking will gradually replace negative thoughts as your depression responds to treatment. It takes time, but it happens.
Okay. Finally, a truly critical point. What if you or someone you know is in immediate crisis, thinking about self-harm?
If there are any thoughts of self-harm, you must tell someone who can help immediately. Do not keep it secret.
Who you call?
Call your doctor, call 911, or go directly to an emergency room to get immediate professional help.
Is there a hotline?
Yes. You can also call the toll-free 24-hour National Suicide Prevention Lifeline. That's 1-800-273-8255.
Right, 1-800-273-8255.
And if someone is suicidal,
Critically, ensure that person is not left alone under any circumstances. Stay with them until help arrives. Okay. Wow. We've really taken a comprehensive deep dive into depression today.
we have unraveling its various forms, exploring the complex causes, examining the nuanced ways it affects different people.
And highlighting the many effective treatments now available, which is hopeful.
Very hopeful. And if we connect all these threads, connected to the bigger picture, it's just abundantly clear that depression is a complex medical illness.
Right, not a personal failing.
Not a sign of weakness at all.
Uh-huh.
And understanding its multifaceted nature isn't just academic. It's the essential first step toward effective support, compassionate intervention, and ultimately recovery.
What stands out most to me after going through all this is the sheer breadth of research and understanding we have now, offering real, tangible pathways to feeling better, to reclaiming one's life. So what does this all mean for you listening? Perhaps the biggest takeaway isn't just what depression is, but the profound difference that informed action can make.
Action for ourselves or for others in our lives.
Exactly. Action that can make a real difference in transforming daily life from the grip of this common yet often deeply misunderstood illness.
Yeah.
So maybe the question to leave you with is, what concrete steps could you take with this new understanding? To either seek help if you need it, offer better support, or maybe just foster a deeper, more empathetic connection with those around you.
Subscribe for more